The sign-in code for this presentation is 4826.
So I am Dr. Sara Mulholland. For those of you who have not met me yet, I'm the Vice President of Expansion here at Full Spectrum. Glad you all could make it tonight for us to talk about professional boundaries in ABA. So for those of you who are analysts and are getting a CE for this, this does count as an ethics CEU. So there's your sign-in code. Okay, task list and ethics code items that we'll be covering today. Under the analyst task list, we have responsibility as a professional, E2. E3, responsibility in practice. E4, responsibility to clients and stakeholders. For the RBT task list, we have F3, communicate with stakeholders. F4, maintain professional boundaries. F5, maintain client dignity. For the ethics code, we're addressing cultural responsiveness and diversity, non-discrimination, awareness of personal biases and challenges, and multiple relationships. So first question that I would like to ask you all, and you can just say it or put it in the chat, what do you think are professional boundaries? What does that term mean to you? Avoiding dual relationships, yep, for sure. I feel like that one is tougher than people think in this field. Being professional. Things you should and shouldn't do to remain professional within the workplace. Thank you. Alrighty. So next I'm going to share with you all a definition I found that I think really summarizes this pretty well for us. So professional boundaries are the provision of therapeutic services within the limits of the provider and client relationship, which promote the client's dignity, independence, and best interests, and refrain from inappropriate involvement in the client or client's family personal relationships. Summarizes a lot of what we see in our ethics code, doesn't it? The following, complying with rules, yep, that's another part of boundaries for sure. So we're going to talk about types of professional boundaries. What are some categories that you feel like professional boundaries may fall into? Not accepting gifts, right? Not being friends with client or their parents, for sure. RBT and BCBA relationships, so making sure those are professional. Great. So we're going to talk about 4 categories of boundaries. Verbal. Verbal boundaries are not just what you say, they're also what you don't say. So making sure that communication is appropriate, that you're using proper word choice. It also involves your body language. So again, what you say is important, how you say it is also important. How your body language is while you're saying it. What do you think I mean by what you don't say? So some maybe still think facial expression, yep, that's a big part of it. You're nonverbal.
Not speaking up when you see something that needs to be addressed.
Exactly, yep. That's a big part too. Making sure that we are communicating what we need to. Written boundaries. So this is our written communication that could be handwritten or electronic. This involves our notes. It involves communicating schedules. Again, word choice. Social cues, yes, thank you, Michelle. That's a big one too. So making sure that what we write is also professional. Remember, written lasts a lot longer than words. Someone said avoiding confrontational or disagreement type conversations. Yeah, we don't want, sometimes we have to have those conversations. So that would fall into the what you don't say. Yeah, sometimes we have to have the tough conversations. Next is time boundaries. So this is keeping to that known schedule. So whether if you're an RBT, the schedule that you have with your clients, if you're a BCBA or BCABA, keeping to the schedule that you have set with those caregivers and the client. So not just showing up, random times when the caregiver doesn't know you're coming, being able to communicate that. Respecting the time of the family that you're working with. So for example, if you say, that session goes from 1 to 5 and things are going great at 5 o'clock, you don't say, oh, you know what, I'm just going to hang out at your house till 5:30 now because things are going great. No, you don't do that without asking. You really shouldn't be doing that, period. But there might be some times that you're like, you know what, we're really working on something. This is going well. You ask the family, you know, is it okay if we finish this task before we're done? Or if they need you out by 5, you're out by 5. Also respecting time for yourself as the provider. So making sure that you are allowing time in between sessions. If you don't have enough time in between your sessions to make it on time to like your second or third one, that you tell your analyst so that they can work that out and that you are getting your needs met. You know, having breaks when you need them. Breaks here is for you, also for the client that you're working with. It's real easy to get lost in everything we're working with the client and things are going really, really well and you just go and forget to give that kid a break. You need to respect the child's time also. Self-care, yes, a very important boundary. Thank you, Michelle. And then the other one we're going to talk about is behavioral boundaries. We deal with behavior. We need to talk about behavioral boundaries. It's what you do and what you don't do. So make sure you are presenting yourself in a professional manner. Know that to these children and to some families, you're role models and that you're behaving as such. So why do you all think it's important to have professional boundaries? Yeah, if anyone wants to come off mute and just have a discussion too, that's great.
I feel like you want to make sure that there's no implicit, like if someone gives you gifts or, you know, that person, like your client's parents or something, they now feel like you owe them something, or that everyone's interests are very focused on the fact that this is therapy and there's nothing extra that is going to convolute the goals of it. Like no extra friendships, no extra like favors or anything like that.
Yeah, nothing get in the way, no quid pro quo kind of stuff. Good, thank you.
Yeah.
We also have in the chat, complying with ethics, maintaining the integrity of treatment. It's a professional environment. We need to act as such for sure. A lot of people commenting about the integrity and quality of services, definitely. So just some areas of reasons that we need professional boundaries to kind of go along with that. We have a professional responsibility. It's literally in our ethics code. We are a part of that child's growth and development. We need to make sure that we are a positive part of that child's growth and development. We're also part of the growth and development for the family. This isn't just about the kids. We work with families all the time, and they grow as well as they learn from us. We're there for some pretty intense moments for the kids and their families fairly often. If we're not being professional, how are they going to feel safe with us during those moments? Have to know that we're going to have connections with the families, with the kids, others who are involved. That happens naturally because we care, because you're doing your jobs. It is easy for those lines to get blurred, so we need to know what our professional boundaries are so that we can keep those solid. Instructional control. That is something we strive for in ABA. If you're presenting more as a friend or a playmate to the child, or a friend to mom or dad, do you really think you have instructional control anymore? No, because it's gotten blurry. We do a lot of parent training. Have you ever tried to take advice from a friend versus a professional? Does it tend to mean more when it comes from the professional? I think generally it does. If we're acting more as a friend, we might not be taken as seriously, and therefore we're not going to be as helpful. And again, remember, we are role models for these children, for the families. They look to us, whether you're trying to be a role model or not, it happens. So again, we need to act as such. Know that you are being watched. They're learning from you. So what are you teaching? What are some other reasons that maybe we didn't touch on or potential concerns if we don't have good boundaries? There's a comment about making sure we're being compassionate while keeping boundaries, for sure. We'll be talking about that. You think about any potential? Oh, go ahead. Yes.
I was just going to say, well, we were talking about the parents and the clients, but I think overall, like work-life balance, like I know, like to not really probably message, after your hours are done, unless it's like something of an emergency. But like keeping a work-life balance for yourself, compartmentalize that. I think that would be maybe a part of it.
Yeah, that can be very important for sure, making sure you have that balance. We have some comments about protecting privacy, being able to help them generalize in multiple settings, keeping those boundaries, definitely. So what are some reasons that it might be tough to keep these boundaries in the work that we do? What are some things that might get in the way? Or some reasons that it might be hard to maintain some of these boundaries?
We're in their homes. I mean, so you're kind of, sometimes you can get blurred a little bit more, I feel, on their part than ours, as them kind of relying on us a little bit more than they should, that kind of thing. You have to be really careful.
For sure. Yeah, it's a totally different connection because they're not coming to an office to see us. We're in the home where they feel most comfortable, for sure. Yep, we have a comment that you have some overly appreciative parents and caregivers. Yep, for sure.
What about like cultural aspects? Because sometimes you work with cultures that like gift giving might be very ingrained, and like some Latin cultures. Like I worked with like an Italian family, and like eat with them, like it was kind of offensive to them, and it, maybe you could argue the rapport would be damaged. You might seem kind of strange because you're like, oh, you want to be very different. You want to be very kind of like outside of that,
Yep. And we're actually going to touch on some cultural issues in this. And a lot of the comments that are coming in are all areas that we're going to be discussing today because they are tough, for sure. So I'm not going to read every single comment that's coming in. They're great, but we're going to be touching on, looks like, all of them. So what makes boundaries difficult? ABA therapy requires connection and pairing, which is also known as therapeutic rapport. Basically means you have a therapeutic connection, which is what that strong pairing is, so that a trust is built to be able to make progress. And a lot of times, I see some comments about this in the chat, a lot of times the providers are the first people that get it for that family. They've been dealing with this. If they've never had any type of treatment, whether it be ABA or anything specifically for what their child is going through and therefore the family is going through, a lot of times we're the first ones that understand, that don't judge. And that immediately makes a very strong connection. We spend a lot of time with these kids. Pretty much every other therapy out there, the kid goes and sees a provider for anywhere from 30 to 60 minutes. We're there a lot of times for multiple hours. So it's natural that there's going to be a closeness. And I want to make sure that you all know that that is okay. If you don't have any type of connection to the kids and families that you're working with, you're not doing your job very well, honestly, because you're not pairing. But we have to make sure we keep it professional. It's okay to feel close. It is not okay to let those boundaries down. We're agents of change. We are there to help this child and their families make change. And when change happens, especially when it's good change, it's exciting, it's fulfilling. There's going to be a connection because of that camaraderie. We did this together. And as someone mentioned before, we have a lot of families that have a lot of gratitude for us, which is great. We have to maintain the boundary of where does that need to end as far as the line, what they do as far as their gratitude. All right, so now we're going to talk about the easy ones. Some boundaries are easy to remember and maintain because we've been told about these throughout our schooling and more CEUs than we can count. Some of those are, we need to notify the family of changes as soon as possible. So that means if we're going to be late or if we're going to be out of town, there's some type of change in schedule or a change in provider, we know that we need to be telling the family about that. We know we need to dress appropriately. There's a dress code in the P&P manual. We know to avoid intimate relationships. That has probably been preached over and over and over. We know that we need to follow the program that's written. We know, even though it may be tough to remember sometimes, to be aware of our audience. Audience is not just who you're talking to, it's who's around you. There are a lot of people around you. Don't be having those sensitive conversations. We know to make sure that our documentation is valid, it's objective, and it's signed off appropriately. We know that we should respect everyone's time. We know our ethics code says don't accept gifts over $10, which goes to the comment earlier. So if they are wanting to do something, we also make sure they know in the first place that analysts are not allowed to accept anything worth more than $10 or RBTs, any providers. That's actually in the caregiver guidelines as well. We know that we're not allowed to engage in any type of exploitation or coercion. And we know better than to discriminate. That's the easy ones. There are some tough ones. First one we're going to talk about is tough ones with caregivers. That could be parents, teachers, anyone who is connected to that child that we work with also. We get a connection with the caregivers, and again, that's a good thing. We need to understand that caring for a child with autism or a behavioral need can be very isolating. And that is why that bond that they feel with us is often so strong. Finally, another adult that understands, that isn't just telling me I don't discipline my child well enough. That isn't telling me just give him whatever he wants so he stops screaming. That creates a huge bond. It's also natural that we're going to have some type of social conversation when we're in the homes. The parents are going to make small talk, and that's okay, but we're going to talk about things to avoid. We're often their connection to the, quote, real world. Again, going back to it being isolating, having a child on the spectrum or significant behavioral needs, a lot of these families haven't been able to get out in public much at all because of the behavioral concerns. So this is almost like, oh my goodness, there are people outside of our family that we can talk to. For some of these families, we are their primary support. They may have been isolated by their own families, extended families, society, neighbors. We're the people that accept them. And again, they're looking to us as role models. So types of interaction with caregivers. Validation is important. Being able to let them know that we get it. It's also crucial to have empathy, and I want to make it very clear there's a difference between empathy and sympathy. Empathy means we understand where they're coming from. We understand why someone may think or feel a certain way. That doesn't mean that we're going to say everything is okay, because we are doing ABA therapy. So empathy would be telling someone, let's say that something is happening, the caregiver is doing something that is reinforcing the behavior and they don't realize it. Empathy would be saying, I understand where you're coming from or why that makes sense. Let me offer you another approach that might be less stressful for you and tell me if you think this is something you could try. Sympathy would be, you know what, I get it, and I'm going to reinforce your bad behavior because I feel sorry for you. That's not okay. But empathy is understanding where they're coming from. Another type of interaction we want to avoid is telling that parent how to parent. This is their kid, not ours. We are working with them We are doing ABA therapy because they are trying to do what they feel is best for their kid by having us in their home. They're not asking us to judge them. Social interaction. You cannot get yourself involved with that parent socially outside of session. Everything needs to be ABA related. And that means online too. And there are a lot of parents who say, are you on Facebook? I want to send you a friend request. And that seems like no big deal a lot of times, but it is. Because now you have a dual relationship. Dual relationships aren't just romantic and professional. Professional and social, professional and friends. Now we have a problem. So make sure that you keep your interaction with these caregivers centered on ABA. Stay in your lane. Do not be trying to give advice or direction on something that is not in your scope. If they are telling you about some struggles that they've had, maybe related to a medical issue, you can say, you know what, that sounds like that's really tough. You cannot say, have you tried this medication? You should, because you are not a doctor. So make sure that you are staying in your lane. And I have to say that because I've seen it done. And I'm just reading comments here to make sure we catch up. Finally, someone that will work with the child so they can have their own time for self-care and remain sane. So true. So true. And a lot of times that's part of what we are to the caregivers also. Somebody else to come take over for a little bit. Somebody to come help. A little bit more about caregivers. This seems to be the toughest area. So I want to talk about when we intervene. So parenting a kid with autism or behavioral needs is a tough job. I don't know how many of you here are parents, whether they're on the spectrum or not, but are there ever times that you feel like you were just going to lose your ever-loving mind? And really understand, yes, a lot of people saying yes. And imagine for those of you whose child does not have behavioral needs, imagine if you added that to the issue. It's tough. Sometimes they struggle with patience. They might yell. They might use the timeout room. They might do something that is definitely not evidence-based because they are doing whatever seems to work. That whole throwing everything in the fridge and seeing what sticks kind of thing. Parent training is not the same as parent shaming. We are not there to tell them, you can't do that. That's bad. How do you feel if someone tells you that about something that you're doing with your kid? You know, or someone that you care for? Are you really going to listen to them anymore? You're probably going to check out if they're shaming you. And I will tell you right now, these parents have been shamed enough without us adding to it. Society looking down on them, making rude comments anytime that they're trying to go out in public. The calls from the schools, your kid did X, Y, and Z. They don't need that from us. They get it from everywhere else. We're supposed to be the ones who give them support, who say, I get it. This isn't your fault. We're going to work through this together. So instead of saying, don't do this, don't do that, we're going to give alternatives. So if we're doing parent training, parent support, and parent training, I know that's a BCBA thing, but RBTs, whether you realize it or not, you're doing it too. Because they're watching you. They're seeing how you interact with the kids. You're talking to them before and after session about what went well and what didn't. It may not be official parent training, but they're learning from you too. So we're giving them alternatives and framing it instead of a way of what you did was bad. Here's something else to try. Why don't you see if that has a better outcome for you or not, and let me know. Never correct a parent in front of their child. Unless it's abuse, of course, which that's a whole different thing. We're going to talk about that in a minute. But if you just feel like what they're doing is reinforcing the behavior, don't say it in front of the kid. I don't care if that kid is nonverbal or not. If they're nonverbal, they hear more than you think. They're paying more attention than the ones who are verbal. Take them aside and talk about it. And yes, someone said RBTs are constantly modeling for parents in sessions. Yes, whether you realize it or not. Never treat a parent or a caregiver in a way that you would consider disrespectful if they did it to you. That whole do unto others thing, right? Now we're going to talk about mandated reporting. So we need to talk about when to make that report. A disagreement with parenting or teaching methods does not warrant a report to child services. Just because it's not the way you think it should be done, just because it's not ABA, does not mean you are calling an abuse hotline on that parent. Abuse and neglect have very specific definitions, and I've put several sources here that I use to synthesize what these definitions are. So neglect. We're going to start with neglect. Is failure to provide adequate health care, education, supervision based on that child's age and functioning, protection from environmental hazards, failure to meet basic needs, leaving the child with a known sex offender, or abandonment. That's neglect. Neglect is not, I sent the kid to their room. Are they safe in their room? Is there a parent in the home who can check on them? Then it is not neglect. Abuse is causing or threatening harm, injury, sexual acts towards a child, causing non-accidental injury, acts to humiliate or terrorize a child, or verbal abuse. When in doubt, consult. Yes, you are mandatory reporters, and you can consult with others to check to see whether or not this is something reportable if you are not sure, because some things are kind of gray. I will tell you, just this morning, I consulted with a colleague about something that was kind of in a gray area to see if she would think the same way that I did about that situation, just to double check. It's always okay to do that first. So now we're going to talk about the tougher boundaries with the kids that we're working with. The children feel connected to us. You feel like a member of their family to them. That's why when you get there, they run up and give you a hug. It's also why sometimes they yell at you and try to hit you, right? They are treating you like they treat their family. You pair with them. I mean, that is part of what you have to do in therapy. So that's going to build a very strong bond. They're going to be excited when you're there, and that's a good thing. You might be that child's only non-family interaction. If they're not in school, like maybe they're preschool or they're homeschooled, you might be the only person that comes to see them that's not family. That's exciting. You also might be the person that is exciting because maybe they have siblings and you come for just them. And that's pretty cool too. You also are somebody who is accepting that child as is. You're not someone who's always telling them what to do. You're not somebody who is ostracizing them. They can be themselves around you, and they may not get that anywhere else. They also get excited when they learn new skills and create connection. That is exciting. So of course they're going to bond with you. And again, your role models. They're looking to you as how to act. So ways we want to interact with the kids. We want to have fun. You can have professional boundaries and have fun. We're going to pair with them. We want to make sure that when we're pairing, it is at least a little bit connected to those goals that they're doing, right? So if they're working on communication, we're involving some communication as we're pairing. We're also taking data and realizing what's reinforcing, what's not. We're keeping it ABA focused while having fun. Reinforcement, amp it up. There's no such thing as too much reinforcement. Yes, sometimes we have to fade it back, of course. But that doesn't mean you don't make it super exciting when we're giving it to them. We want to make sure that every intervention we do is following the plan that's in place. And make sure that it is ABA focused. So if you're an analyst and you're making a change to the plan, make sure that it is related to that function, that it is evidence-based, that it is something that makes sense. We also, with those kids, want to set clear expectations and schedules. That doesn't mean we have to be like, at 10 o'clock we do this, at 11 o'clock we do that. But so they know what to expect from us, and they know what we expect from them. How are they going to learn new skills if we don't make it clear what we're looking for? It's also very important to know that we are not interacting with them socially outside of sessions. We can do community sessions, 100%. Those are fantastic. They need to be related to behavioral need and not just because the family wanted an excuse for you to come hang out. Birthday parties are tough. We get invited to a lot of birthday parties. It's okay to say no. Because if there's not a behavioral need going on, something that the parents are asking for support, you really can't be there because you're not their friend. And I know it's tough. Doesn't mean you can't have fun around their birthday in session and do something special there. As far as, I'm not saying bringing them a bunch of gifts. Don't do that. I'm saying maybe do some of their favorite activities in session around their birthday. Maybe the reinforcement is, amped up a little more, or a favorite activity that you don't normally do. All right, tougher situations when it comes to the family as a whole. You get connected with the entire family when you're doing those in-home sessions, part of the job. You don't just pair with the children, you pair with the family too. And again, that is part of the job. That is great. So families may want to include you in things other than session. They're going to invite you to meals, to the birthday parties, to outings. I had one mom say, I want to go to the mall with you. And I had to say, I can't do that. And I just explained very directly, very nicely, I really appreciate that. And I think that's awesome. Given my role, I can't hang out outside of session. But thank you so much for thinking of me. You have to avoid those dual relationships. And as soon as you're interacting socially outside of session, now you have a dual relationship. Know that any time you are spending with that family has to be billable. That's one way to check yourself. Is this billable? Is this really something that I'm working with this child? Are we working on specific goals? Because if we're just hanging out and having fun, it's not okay. But like I said, we can assist behaviorally in the community if there is a clear need, 100%. We just have to make sure that need is documented, that it's clear why we're doing that. If the kid tends to yell and scream in the grocery store, yes, you can go grocery shopping with that family as long as you are working with that child and helping them change that behavior, learn something new. You're not going to spend holidays with the families or go to their social gatherings or their family reunions just for social connection. Make sure that you're setting that clear boundary at the beginning, but still be friendly. Okay, being professional doesn't mean you're stuffy. It just means you're very clear on what your role is. You're still friendly, you can still chat, but you just make sure that you're keeping it within your scope. All right, so the tough conversations. There are some topics that are great and not so great. So, good conversation topics are things such as what procedures we're using for ABA, explaining that. You know what else is a great conversation topic? Talk to them about extinction burst and spontaneous recovery, because man, those are scary to parents or the caregivers. They're like, what is happening? It's a great conversation to have. I talk to families about these extinction bursts and spontaneous recovery at the beginning every time, so that they know it's coming and they know what it is. It's great to talk to them about the progress that's being made, for sure. It's also great to talk to them about what behavioral concerns they're having. What are we seeing in session? What are you seeing at home? When we leave, how are they acting? Does the behavior change, when we leave or when we're not here? It's also great to be giving feedback and gaining information about the goals that they have related to ABA. Great conversation topics. Topics to avoid: religion and politics. Oh my goodness. You should stay away from those with your own family too, honestly, but especially at work, because those are just going to start issues. Me too, I'm not talking about the political movement. I'm talking about when you have something in common with the parent, and this is probably one of the hardest ones to avoid. We have all fallen into it. We start saying, oh yeah, I've had that exact same experience, and then we go into a big discussion about it. Again, you can say, I understand, I've been there, but don't start trying to give them advice based on your own experience of how they need to handle their situation. Sometimes I have had more than once that someone has told me that they thought they were validating, or they thought they were being supportive to a family, and the family took it as insulting because they've got their own history. Maybe there's some trauma in that background that you don't know about. So you can just say, you know what, I've been there, I get that. and switch direction. The parent's health, mental health, or economic status, or history of any of those. Don't engage in those conversations, and they might tell you the whole life story. So it's okay to redirect. Doesn't mean you have to be mean about it. You can say something like, man, that sounds like that was tough. Hey, did you see what we're working on over here? How cool is this? Segue into something else. That way you're not disrespecting them. You're letting them say it, but you're also not engaging in a big conversation about it. Never talk about other clients, other families, or other providers to the families that you're working with. Basically, avoid anything that's not directly connected to the ABA services you're providing, and you'll be all right. What if the parent's health is related to how they can help their child? Then you keep the focus on the kid. So if they have specific limitations, then okay, let's look at some ways that we can do this intervention that you're able to do, physically or mentally, whatever that is. Keep it on the child. So written boundaries. Remember, what you write lasts a lot longer than what you say. Once it's written, it's there forever. Even if you hit that delete button, it's in cyberspace somewhere if it's electronic. So make sure you stick to the facts, just the facts. Keep it objective, like ABA teaches you all the time. Look over your word choice in your notes, in your documentation, whether it's an assessment or a session note. Read it back over and see if it seems objective. Use ABA verbiage. That's not when you're writing something for the caregiver, if they're asking for directions. That has to be in layman's terms. You have to make sure it's something that they can understand. If you're documenting those, such as your note, use the ABA terminology and you can't go wrong. If you're unsure of a term, so maybe it's an option that you see in the notes, I'll tell you I can't count how many times I've seen someone check the box for response cost and they didn't use response cost because they're not really understanding what that is. If you're not sure, ask an expert or research it to find out before using that terminology. Yes, thank you, Dr. Bellotti. Very careful with texting, 100%. I don't care if you deleted it or not. Somebody screenshotted it by then before you deleted it. I guarantee it. If you're having a rough day or a rough session, don't submit that note right away. Read it over later. Make sure that you can't tell that you were ticked off when you were writing that note, because sometimes it comes out in your words. Make sure it was objective. Remember that insurance reviews your documentation. Remember that parents can request to see your documentation. Think about how you would feel reading that note about you or your own child. And again, we have to be objective, very clear. If they engaged in 500 behaviors, you're going to have documented that, 100%. But it's going to be objective, so that even as a parent reading it can be like, yep, that's what he did, without feeling like, oh, they're judging me. Oh, they don't want to work with me anymore. You never want to give that type of feeling. Also remember that health records can be subpoenaed. If something legal is going down, they can actually subpoena those records. So my motto, and many of you know I worked in prison for many years, so I learned this: always document like it's going to court. Make sure it is clear and objective and doesn't have your opinion in there. Yet progress of clients' programs and session notes. Yes, make sure it's very clear. What's going well, what's not. All needs to be in there. Ethical behavior. So we're just going to talk about some sections there. Cultural awareness, responsiveness, and humility. This goes to some of the comments earlier as far as cultural awareness. Take time to learn that family's cultural needs and learn about it. So if they have a completely different culture from you, I'm not asking you to do a research paper, but take some time to learn about that culture and what's important to them. And don't assume that everything on Google about it is correct. You can ask the family. Doesn't mean you're diving into their entire history, because again, that's a boundary. But it's okay to ask about their cultural needs. If they mention, they observe a holiday that you don't observe, then say, you know what, that's great. You don't want session that day, you let me know. Or if you do want session that day, you let me know. Make sure that we're being aware of that. Also respect and incorporate their cultural needs and preferences into therapy whenever possible. So if they come from a culture that doesn't make eye contact, do not work on eye contact with that child. That's rude. Because in their culture, it's viewed as rude. Instead, you will work at some other type of acknowledging that we're communicating. As far as the gift thing that was talked about before, again, if we make it clear from the beginning, nothing that is worth more than $10, but also make it clear of, one, you don't have to thank me like that. I am seeing the progress. I am seeing that you guys are happy, and that is fantastic. But also, don't downplay what they're wanting to do. So just make sure they know what that guideline is. Communication. Make sure that when you are communicating with families and caregivers that you're using language that they understand. We can talk to each other about ABA terminology all day long. A lot of the parents don't know what that means. I actually read when I was doing research for this, a study that actually called it being bilingual. We speak ABA language to each other and layman's terms with the caregivers. Make sure that we are being professional, but again, that does not mean stuffy. I will tell you, when I was working on my supervision hours, I had a supervisor who was somebody I would call stuffy. He wasn't by the time I was done with him. But the way he approached everything, and he told me, he's like, "You're going to act like an analyst someday." And I looked right at him and I said, if that means stuffy, that's not going to happen. But over time, I realized what he meant as far as making sure that everything is very ABA centered and that we are being very objective. But I still got him to lighten up, and I was very proud of myself for that. Make sure that we keep those communication lines open appropriately. So again, the time boundaries. That's why we actually have in caregiver guidelines that caregivers are not to be contacting the providers after a certain time or before a certain time. You can set different times as well. If you can let them know, hey, you know what? After 5 o'clock, I'm in school. So if you need to tell me something, email me, please. How do we decline gifts professionally, especially gifts that are already bought and put together, even after we've made the boundary clear in the beginning? Yes, that is a great question. Really, you can fall back to the ethics code and tell them, you know what, that means a lot to me, and I love that you wanted to do that. Unfortunately, based on our ethics code and my job requirements, I am not allowed to take this. So it's not that you're rejecting it from them. You are letting them know you are not allowed to, and you don't want to do something that could jeopardize your job. I always fall back to that when needed. You know what? My job title, my ethics code, my profession says that I can't do that, and I don't want to get in trouble. So thank you so much, and that means so much. Can I take a picture of it? You could even do that. But I'm sorry, I cannot accept it. Great question. Contextual variables, and this falls into something else that was asked about originally. Conditions for success, making sure that the team fits with the family and the interventions can be implemented by the family. So if you've got a family that has 5 kids, you cannot be and it's a single mom, you cannot be telling this mom, you have to sit down with this one child for 15 minutes and not do anything else 3 times a day. Do you think she ever has 15 straight minutes to do anything? Probably not. So if you're looking for non-contingent attention, you make it different, a different type of schedule, a different way that she can do that, maybe a way that also involves the siblings. Okay, someone else added, I'm thinking about when we work in the schools and the clients or children give them to us. So accept them from the clients or children and then leave them with the teacher when the kid's not in the room. So you can tell the kid, you know what, thank you so much. That was so nice. And then when they leave, let the teacher know, hey, I can't accept this. Can I leave this with you? Can you donate it to somebody, something like that. And that way you don't hurt the kids' feelings. Yep. So back to the contextual variables, the conditions, making sure it's something they can actually do. If they do have some type of physical or medical limitation, say maybe they walk with a limp or they have some type of struggle as far as movement, don't be telling them they need to go on a run with their child. All right, make sure that the interventions you're doing, that you're incorporating, are things that that family can do also realistically. And you can talk to the family about it. Hey, this is something I'd like to try. Is this something that you would be able to do if I'm not here? And if not, okay, how could we make this work? All right. Setting boundaries can be hard. We just need to be very objective, just like everything else in ABA. Keep it objective, keep it functional. Every time I talk about boundaries, I think of this movie, so I had to put that in there. This is my space, that's yours. Don't be afraid to say no. It's tough. It can be tough to say no. No, we can't do that. No, I can't hang out with you after work. Again, you don't have to say it mean. You can always fall back on, I'm not allowed to. I appreciate that, and I think that would be awesome. I am not allowed to, because my job is I am here to work with you and your child. Also know your own comfort zone. So we have our professional boundaries, but some people need even firmer boundaries, and that's okay. Just know what your comfort zone is before going in so that you can set those boundaries when needed. And also respect the comfort zones of others. There may be some family members that don't want to chit-chat, not even about what's going on in session. Just, okay, he did well. What do you want me to do? Okay, we're done. You respect that because that's their comfort zone. And like everything else in ABA, remain consistent. If you set a boundary, you keep it. So ethical boundaries, professional boundaries require ethical behavior. Make sure you're able to use your professional judgment. Remain within your scope. Stay in your lane. Do not be giving advice on something that you do not have training in, that is not part of what you're there for. Acknowledge when you need to consult with somebody. That's okay. If the parent's saying, hey, I want to address this behavior, and you're like, oh my goodness, I don't know what to do, you can say, you know what, that's a great question. I'm going to talk to one of my colleagues and see if we can come up with some good interventions for you. Also, it's okay to refer to additional specialties. If something's going on with that kid that seems a lot more mental health related or physical health related, it's actually our ethical duty to refer to other specialties for that. Doesn't mean that we can't help them on the behavior side, but you can definitely say and should say, you know what, that is not my area of expertise. I would recommend you talk to your doctor about that. Documentation, document everything, even if it seems minor. Because remember, if it isn't documented, it didn't happen. And that might bite you in the butt someday. So make sure you document. Also make sure that all your documentation is HIPAA compliant. So don't be writing things on a notebook and leaving it in their home. Don't be putting things, private information in your personal email. Make sure you're using your full spectrum email because that is HIPAA compliant. I will tell you, I even use initials in emails and Teams messages. Even though it's HIPAA compliant, I still use initials because you just never know. And your knowledge. Again, as I've said many times, don't provide advice or guidance on something that is not part of your role. Keep up to date on changes and guidance and developments in ABA because this is an ever-growing field. And you do not want to be saying something ABA related that is from 20 years ago. Things have changed. Never share your opinion as a fact. If you are sharing an opinion about something, first of all, see if it's even relevant, and if you should, probably not. But if you are, make sure it's very clear that it is opinion. Sometimes boundaries get violated. It's not intentional, it's a hazard of the job, it happens. So we need to make sure that we're resetting those boundaries as soon as possible. So when we need to reset boundaries, that means we've realized a violation has happened and we need to fix it. First, we have to recognize that a boundary was violated in the first place. If needed, consult with a peer or a supervisor to talk about it and what needs to be done. If it was a supervisee, let's say you saw a supervisee violate a boundary, make sure you address it objectively. It's a learning moment. Make sure you meet with those that are affected by it. Even if they didn't necessarily realize it, make sure that you have a meeting with them so that you guys can acknowledge what did happen, why it was a problem, and be able to discuss it calmly. Don't discuss it when anybody's angry. Then you make a plan and a remedy to avoid it and document how you address it, whether this is in a session note or in an agreement with the person, just depending on the severity. But make sure it is acknowledged, documented, might be an incident report depending on how severe it was, and what that plan is moving forward. Once you reset that boundary, you actually have a stronger professional connection with the person that you had to do that reset with. All right, so that concludes the presentation. Anyone who wants to stay and ask questions, feel free to do so. Thank you. You guys have a great night.
The sign-out code for this presentation is 6284.